Question, is Obama forcing private insurers to bring down costs by bludgeoning them, economically speaking, with a government-subsidized program that takes their business away? Clarence.
Well, one can only hope, John. I mean, we're talking competition here. You know, first of all, what do we care about? Taking care of people, taking care of insurance companies. I'm kind of annoyed by this whole notion, well, you're going to hurt the poor insurance companies.
Private sector insurance because taxpayer money is unlimited and the government will consistently underbid the private insurers.
Right. Mankiw was talking about how the insurance companies can't stand competition. How about competition was good? You're going to have choice, and you're going to have competition.
The problem is
that's going to help the public.
As he points out there, Fannie Mae and Freddie Mac started as private companies. They became public companies, and then they were indestructible.
That's a subject for a different show, John. I just want to get this in. You know, we're hearing from the supporters of the status quo that we're going to lose coverage, going to lose choice. We're losing that now with private insurance. The private sector has failed to support and serve the public in a satisfactory way, and that's why we're having this whole debate right now. And I think that's why the public is going to vote for some kind of a public option to compete with the private market, whether it's called a co-op or something else.
75% of the American people who have health insurance like their present system.
That's what I hear. I don't know who those people are, John. I mean, I've heard these polls too. I think that again, is how you phrase the question.
You don't worry that the government is going to be rationing doctors, rationing hospitals,
the private sector rations now.
Yeah,
the private sector rations now, John. Believe me, I've been out in the workforce for over 40 years, and I'm constantly getting cut back by private insurers, and the companies do shop around as they should.
You have to start at the point that the current system is unsustainable, so something has to be done.
Look, well, why does it have to be radicalized? Why can't we do something that's
This is not radical. Exactly. This is not radical. This is a halfway measure. It's choice. You're going to have choice. The public will decide.
If you like your insurance, you can keep it.
That's right.
That's not true.
That is true.
It is true. That is not true. That's a key dishonesty in this whole debate.
Let Rich in. We've heard this side. We've heard this side. Excuse me.
You didn't hear me finish my sentence. In today's market, your employer can cut you off. The insurance company can say you have a pre-existing condition. It is not Nirvana today.
Sure, the status quo is imperfect. It does need reform. But what the House bill does, according to an independent group that studied it, the Lewin Group, widely respected, 80 million people out of their private insurance into the government plan.
That's not what the Congressional Budget Office
cannot admit that because it will sink the whole
thing. Those projections are based on a plan that hasn't been voted on yet.
Thank you. On the question of competition, there are thousands of private insurers already on the scene. We have plenty of competition. Last time I read the U.S. Constitution, thousands of insurers. Last time I read the Constitution, the Founding Fathers did not have in mind that the federal government would be selling health insurance. Does that mean that reform is not needed? Of course not. The Republicans do have alternatives that are free market based. But what this is really about, this is not about health care. This is about the federal government led by Barack Obama and the far left, which is why you've got a splintering off of moderate and conservative Democrats who don't like this one bit because of the cost and because of the explosion of big government here. But the far left is driving this because it seeks to take over more and more of your freedom of choice in every
Please now, come on.
Eleanor, go ahead.
It is not the far left. It is the Democratic Party operating on the mandate that it got from the voters when they elected Barack Obama.
So how do you explain the poll numbers crashing?
Going to 59% popularity is not exactly crashing. And going to pass. Let me finish. Excuse me, my turn. Getting to 50% and 49%. Given all of the bashing people like you have done, he is now getting control back of the debate on this issue.
Bashing? And you know who's done the most bashing? The director of the CBO.
This is a battle within the Democratic Party. The legislative process is going on. We have not seen the finished product yet, and the Democrats have the numbers, and they're not going to blink this time like they did in 1996.
All right, good question. Excuse me. Please relinquish the Democratic Congress, assuming the Democratic Congress passes health care reform. Will a single-payer government program eventually not only dominate private health care, but eliminate it?
Yes, that's the entire point. Unless this reform is stripped down radically, that's what will happen, and that's what the liberals want.
There will be 40 to 50 million new customers, and a lot of those customers are customers that the private market doesn't even want. And there's plenty to go around that you can coexist with add-ons, and the government is going to provide a subsidy, a very basic plan, and people will buy extras. The insurance industry will flourish. But I'm with Clarence. Since when is this about protecting the insurance industry? They're not protecting people.
Poor insurance companies.
They're making a ton of money.
No,
go ahead. All right.
Let me hear from you. Your insurer to go out of business, Clarence?
Well,
do you want your insurer to go out of business? Do you want to get dropped from your employer coverage?
My coverage has been going down, Rich, and so has a lot of other people. And I'm not in bad shape.
You want to go into a government plan. You're going to sign up for the public plan.
Monica, this is an exit question. Let's go.
I'm going to go buy into it.
Hold on, Clarence. Hold on. Don't let them bait you that way.
Government health care.
Bringing us back to the exit question.
How do you like Medicare? Let me ask you that.
This is exactly where we're heading, to the single-payer system, if in fact this gets passed and signed into law by President Obama. Barney Frank a couple of months ago said as much. This is the objective of the liberals, and just as President Obama allowed Nancy Pelosi and the far left in the House to write the economic stimulus, he has allowed the exact same thing to happen here, and that's why I don't think it's going to succeed.
What's the answer to the
Well, kind of amusing, Rich, one is about the public health care, because I'm almost Medicare age anyway, and Medicare is one of the most popular programs.
And it's bankrupt.
Well, that's a question of
because of government run. Because of government run.
It's not bankrupt. And the status quo, medical health care costs are doubling right now under the status quo. Obama's plan will be a 10% increase in order to get the same thing.
What's your answer to the question? I think we know.
What's the question again?
The answer to the question is the problem is that taxpayer money is behind the government program. Therefore, it's unlimited. The government will underbid the private sector programs because it's got a natural tendency to maintain itself in existence. And that will mean the end of private health care over time. And I think it's a bad idea.